Of course, we have to have you. You are an infectious disease expert, and there's a lot of questions that we have today. So let's dig right into it, Dr. Balani. Just starting off this interview, I'd like to discuss some numbers that are coming in today. We're looking at 27.7 million cases of COVID-19 in this nation, with at least 486,000 deaths. We're actually approaching 500,000 deaths in this nation. My question to you is, how are you observing these numbers? And we keep on hearing there is a downward trajectory of these numbers happening right now. What insight could you provide us on that?
So definitely the numbers are unfortunately very dismal, especially with the January. It's been about a year today, nearly a year since we've had this pandemic going, and the numbers have been unfortunately skyrocketing. Good to know, though, that this past weekend, we were actually just talking about it, that this past weekend we had only 12 patients. I said, whoa, that's really amazing. So yes, we are seeing a downward trend. In the last maybe 5 to 7 days, definitely we've seen a marked decrease in the number of cases, and we hope that it'll continue to do so as time goes on.
Right. Experts are right now worried about a fourth surge of COVID-19. Are you concerned about that?
I am. And we have relaxed our restrictions in the city, in the restaurants, in certain gatherings, etc., that has happened. Plus, the patients, the subjects who've taken the vaccines are probably a little bit more complacent, a little bit more relaxed in their social distancing or masking techniques, etc. And then also the whole concept that, oh, the virus, it's not so bad, it's just a little bit of a cold, etc. This particular wrong conception kind of makes them more attuned to not follow the directions as recommended by CDC. It's also been 1 year long. So this particular fatigue that comes along with having the virus and having these restrictions is kind of coming to a head also to these patients, requiring less of the social interacting, less of the masking and universal precautions that are required. So I think I do worry about the fourth spread happening, also with the variants coming along and us not being able to vaccinate as fast as we would have liked to. I think that would also cause increased infectiousness and therefore increased number of cases.
Yes, you just mentioned the variants. Let's talk about it a little bit, Doctor. There is the UK variant, there's a Brazil variant, and there's one from South Africa. They are saying right now that the UK variant seems to spread, the virus more fast, and it's also more transmissible. With the South African variant, due to that variant, South Africa had to stop its vaccine of AstraZeneca. So how are you looking at these variants and their impact on the existing vaccines and the vaccines that are about to come?
So, first and foremost, the variants are not new. Yes, we are learning about it a little bit more often now in the media, but the variants have been around since last March. So we had genetic sequencing done showing these particular changes occurring. But of course, case-based variants that actually made a clinical difference probably have started since the fall of last year, with the UK being probably the most likely of the cause, being the most commonest of this particular variant. So amongst the three variants that are currently around, the UK variant, or the B117, is efficacious. The vaccine is efficacious against this particular strain. What we're looking at is where do these particular mutations occur in the virus that leads to whether these vaccines or monoclonal antibodies for treatments will work or not work. It all is dependent upon their binding sites. So with the UK variant, that particular binding site is still efficacious with these particular vaccines. The South African one, yes, it is going to be efficacious, but not at the 95% efficacy that we have today. There would be slight fall down of that particular folds, but we're starting with such a high bar of the mRNA vaccines efficacy that I think a little bit fold drop would still be okay for these particular variants. Regarding the AstraZeneca question that you asked me, yes, there has been data, clinical data on the clinical trials using the AstraZeneca and the South African participants, where nearly 50 to 90% of patients had the variants, where they found that the efficacy, instead of being the 66 and 72% that they quote in the US, was lower at 50%, 49 to 50%. But it's better than zero. So I still feel that having vaccines on board is going to be efficacious and is going to be crucial in trying to get these variants under control. The last variant with the Brazilian one, with the P.1, that one I think is going to be a little bit more troublesome because it has multiple mutations. I think it's 17 mutations that it has. And out of those, 3 of them are at the receptor binding site. Why is that important? Because remember, all our current vaccines are targeted towards the spike protein antibodies. And if your variant kind of evades that immune system clearance, I think that would be the trouble one. So I think we have to keep a watch on what variants are in the community. And hopefully this 4th wave that we worry about is not going to be one which is going to be the difficult to treat.
Just discussing this 4th wave quickly, Doctor, we here in Tri-State in New York, New Jersey, Connecticut, even Pennsylvania, saw the worst of this pandemic last year. How concerned are you looking at these variants that we may become an epicenter again? What are the chances?
So unfortunately, northeast US, just like certain other ports, is a biggest port of call. With the global travel, with the how small the world is today, I think we are going to get more, and with the infectiousness and the closeness and the density of population in this northeast states, I think the spread, unfortunately, will also be much faster. And if we don't go ahead and do our social distancing and masking and hand washing, etc., I think we're going to be a little bit more troublesome.
Right, and you just mentioned mask, and I have to ask you, what is your take on double masking, which the CDC now has suggested as, adding another protective layer to against the virus? How are you looking at it? There are about 3 states that have actually lifted the mask mandate. Do you think that's wise right now?
I don't think it's wise at all. I think having a mask on is absolutely most essential than even 2 masks. I think having the double mask definitely increases the effectiveness of the masking. But I think just having a mask on appropriately, properly, on your nose, on your mouth, with a tight fit is, I think, probably the most crucial in requirement. So I think having universal masking is absolutely essential and should be maintained throughout all the states to try and help with as much drop in the inoculum as we can of the virus from one person to the other.
Right. Let's now dig into talking about the vaccine, Doctor, because I have a couple of questions regarding it. The first question is, we know there's not a huge difference between the Moderna vaccine and the Pfizer vaccine in terms of the mRNA technology that's been used, but are there differences in side effects or other differences you have seen in your research about these 2 vaccines?
So I think they're very comparable in their efficacy as well as effectiveness as well as side effect profiles. I think having a little bit of reactogenicity after the second shot in those who have never seen the COVID infection in the past. And why do I say that? Because if you've had COVID infection in the past, I think you can get the reactogenicity even with the first shot that you take with the vaccines. But that reactogenicity is, I think, very comparable to both of these mRNA technique vaccines that are currently around. Getting fevers, getting chills, getting body aches, getting soreness at the site of the injection, getting redness, a little bit of fatigue, etc. that occurs could happen in either or of these agents. The Bell's palsy that has been correlated, or with the media of the low platelets, etc. Those things are very far and few, and really have not had a direct correlation to the vaccine itself. I think they have to be looked at. I think they have to be monitored, given the fact that these are very new vaccines. I think we are all being very serious about any and or of these particular side effects, but I don't think it's really much of a difference with one or the other.
Right. And let's now look into Johnson & Johnson, Doctor, because their vaccine dose is going to be a single dose, which could be a game changer. However, their efficacy is lower than Moderna and Pfizer. How are you looking at this vaccine? And Is that efficacy enough right now for it to be, distributed across the nation?
So I think it would be great if all of us could have the mRNA vaccine, right? It's 95% effective. But I think it's always supply and demand. And at this point, at this juncture, anything that we have today is going to be far better than nothing. So if there is a issue with the demand of and supply of the mRNA vaccines, I think having a 50 to 70% efficacy of any other vaccine that we have is going to be the crucial key. Plus the fact that it has a very significant advantage of being a single shot, I think that's phenomenal. I think having a vaccine that is going to give you that 50%, 80%, 60% efficacy very quickly within 2 to 4 weeks after taking a single shot is going to be far better than having zero efficacy at all, and or even down the road at the with the mRNA techniques, which still take at least 6 weeks, given the fact if you take Moderna, for example, it is 4 weeks of vaccine time and 2 weeks thereafter. So I think the added protection that you get with an earlier efficacy point, I think is far better than having zero. And also, actually, let me put in one more word, that even though the efficacy overall is slightly bit lower, the efficacy in severe disease and hospitalized patients is great. It's 85+%, which actually decreases the chances of you getting into a hospital. So yes, you may get COVID and you may be in that small mild to disease category, but having being saved from severe disease is, I think, a big positive impact.
This location is a collaboration between the New Jersey Department of Health and the New Jersey State Police. Both of those agencies approached us and said, we'd like to open a mega site at the Meadowlands racetrack.
We're going to be gearing up to be giving out 2,400 vaccines a day, which is just incredible.
We're going to be able to get people in here both safely and efficiently.
Honestly, there's no reason you can't get this. So well organized, and it was painless.
To those who are considering getting the vaccine, your choice is affecting the people around you and moving the community forward.
We are going to defeat this virus and this pandemic once and for all.
What about AstraZeneca, doctor? The WHO, World Health Organization, just approved it to send it to poorer countries, in their effort to vaccinate all across the world. How are you looking at the research in AstraZeneca? Do you see it being approved here in the US?
So I think it is a phenomenal medicine again. Why? Because the maximum advantage that we have there is the ability to have that particular vaccine at room temperature. Right. So in certain areas, even in US, if you look at certain Midwest where they have to travel a long distance to get there, and where the number of people may not be as much, that to have a Pfizer unit having a storage of -70 may not be feasible. So I think having the ability to deliver vaccines to areas where there is financial, economic burden, where there is less resources, etc. I think having an agent that's going to get you to that 50 to 60% efficacy is going to be very, very good. So I think having AstraZeneca on the armamentarium of approved EUA vaccines has been a great advantage to the world.
What is your comment on using different doses for the 2 doses of vaccine between Moderna and Pfizer?
So I guess I have to defer that to the scientific data, but I think it is just the way that particular vaccine had been studied in the preclinical phases to be able to roll out in the doses that were studied. So I think it's a very fast developed vaccine in both of these cases, and those were the doses that they had picked up in the early phase 1, phase 2 studies to be pushed over for immunogenicity.
Right. I know you also got the vaccine, but you were also one of the first doctors to treat a COVID-19 patient in the state of New Jersey. How was that experience for you getting the vaccine? I must say it must have been such a relief, perhaps for you who has seen it from the beginning.
I have, said before also, like once we got the option, forget the vaccine, getting it in December. It was mostly, as soon as we got the vaccine trial site approved at Hackensack, and being a part of that, I think was a blessing. It was a light at the end of the tunnel. We could see ourselves saying, you know what, just get vaccinated. That's going to help us get this particular pandemic under control. Having seen the severity of illness of this particular disease, having lost friends, having lost family to this particular disease, having seen families suffer in the hospital has been heart-wrenching this past year, and it's been very difficult to kind of bear through. And seeing this particular vaccine, which will have a positive, major impact for this whole global pandemic, I think it has been just fantastic.
Yeah, I can imagine. And again, thank you for the work that you and all the other frontline heroes are doing every single day, saving lives and so much more. I just have a couple of questions left here for you again on vaccine. We are getting a lot of questions about the immunity of the vaccine. How long does it last? And also, if you have had COVID before, should you go and get vaccine? Two-part question.
So let me start with the first one. When you have either the disease or you have the vaccine, your body makes spike proteins. These are the proteins that will help fight against the attachment of this particular virus when it comes into you. So with this particular immunogenicity that occurs, the immune improvement that occurs, can happen with both natural immunity, which is through the disease itself, and or through the vaccine that we put into you. In both of the situations, given the fact this particular virus has just been a year old, it's hard to really say how long the immunity is going to last. We know that the chances of reinfection and after a natural infection is rare in the first 90 days of getting this particular infection. There are some data coming out from the UK that particular natural immunity may actually be not 3 months, it may be even 5 months or 6 months. So again, as of today, we pretty much say that the reinfection rate is lower or less often in less than 90 days after natural infection. So we're kind of keeping that 90-day mark as our how long the natural immunity lasts as of today. Things may change. It's a very fluid situation. Regarding the vaccine, also, we're kind of correlating it again with the same kind of corollary as natural immunity, more so because, again, the vaccines are relatively new. The study that is ongoing with both Moderna and Pfizer is a 2-year-long commitment. So we are talking about having data on the subjects who've enrolled in this study, who've actually been the heroes in this particular field to give us the data that we have today for the EUA. Now, those subjects are going to be followed for a 2-year mark. So as time goes on, that particular perspective, how long the immunity is going to last, is going to be revealed to us. So we will know more as time goes on. So as of now, we are kind of contemplating a 3-month mark for the natural immunity, and definitely longer for the vaccines. Regarding your second question, regarding if you've had COVID infection before, should you get vaccinated? Answer is yes, because as I mentioned, the natural immunity may not last too long. So trying to have the vaccine on board is going to help boost that response that you probably already had. And therefore, getting the vaccine in, even if you've had the virus before, is very, very important.
Right. I just have 3 more questions left here for you, Doctor. A very popular question coming in here. What can you do after you've been vaccinated and given both the shots? You know, some people want to know if they can travel. Some people want to know if they should still wear a mask. Some people are trying to see if they can now visit their relatives or gather with more people around. How are you looking at all of this?
So to start off with, I think be very careful that if you've taken the 2 vaccines, it doesn't mean that you have the go-ahead to do whatever you can in a risky behavior. Remember, you're going to be commingling with people who may not have had the vaccines yet. They may still be at very high risk of getting the disease. You could be carrying you may be an asymptomatic carrier. The vaccines are very good. They're 95+% effective, but there are certain populations that it has not been studied on. For example, if somebody is on is immunocompromised or is immunosuppressed, they may not have the same level of immunity as a normal healthy adult host. So that 95% is not a 100% rule. It's not a final answer. So there is always a possibility of having asymptomatic carrier or having mild disease, even if you've had the vaccine. So please be careful for yourself, your own self, and more importantly, for people around you who are with you, who may be at risk of having severe disease. You may have a mother who is 65 years and older, or a diabetic host who may have a much more severe disease, or a young asthmatic child who may have a much severe disease that can occur with this particular disease. So please be careful for not just you, but for all around you. So please maintain having a mask on all the time when you're out in the public. Avoid crowding, wash your hands regularly, make sure your mask fits over your nose and your mouth. Don't still be in an area where it can still propagate to the other people. So I think it's going to be very important to continue to maintain all of those recommendations and restrictions throughout the care. I do think that having the vaccine will be a requirement, or at least a suggestion for travel. And there may be possibilities that our quarantine may be a little bit lifted or a little bit lighter in those who've had the vaccine complete series. But as of today, I would still continue with strict rules following of the CDC recommendations of social distancing.
Yes, definitely. And wearing that mask is so important. We've just been stressing this on the show since last year. Another question that's been concerning parents nationwide, doctor, is a debate between vaccinated educators and teachers and versus opening the schools. The CDC came up with a suggestion that the schools can safely open up even if the educators or teachers are not vaccinated. There hasn't been enough data showing that the children in school are causing COVID-19. How do you look at this? And if a parent is deciding between these two decisions of staying virtual or sending the kids back to school, what would you suggest to them?
So I think, one, it is going to be a very personal decision of that particular parent. Two, it's going to be the decision of that community. Three, it's going to be the decision of that particular state. The government may have the rules as what they are, but I think the state and the local communities pretty much guide their student body populations. I do think that if all restrictions are followed appropriately as recommended by the CDC, I think the rate of transmission in the school family members is going to be much lower. Is it going to be nice to have all the educators vaccinated? Absolutely. And at some time point, I think we should have everybody listed and be able to get vaccinated. So I think the most important thing is schools can definitely reopen in person, but having and following the rules is going to be important. So you could be, wanting a very well ventilated school or a classroom. It may not be possible in certain school districts. So again, each school district has to see their own ability to be able to follow those rules appropriately, to be able to have a decrease in the number of cases.
And finally, my last question to you, doctor, is actually about South Asians at high risk. This whole pandemic, we have seen the population being impacted a lot with people that have diabetes, heart conditions, lung diseases, and high blood pressure, and so on and so forth. It's very prevalent in our community. What's your biggest advice to all these people? How should they take care of themselves until they get the vaccine?
Absolutely right, Aditi. I think it's very important, especially for our community, to be aware of the various prevalent medical conditions that we have. As you rightly pointed, diabetes and heart disease in the younger populations is also actually very high. Family history is very strong in the South Asian community. So being aware of what your risk factors are is going to be very important to know. Plus, maintaining those social distancing, etc. factors is definitely important. If you do develop the disease and you have underlying conditions that make you at risk of having severe disease, I think proactively asking for early treatments, monoclonal antibodies, etc., is going to be important in your scenario. So you should be taking it with your provider. Whoever has a disease that's early on, COVID, and you can potentially interject with agents that could hopefully decrease the severity of the illness in you.